I was at the council when Klein hit, and almost overnight he went after the nurses in the trenches. That's what we called it. It was like war all the time. The first thing I found is late one night, this was when I was a volunteer, and I came across a woman being abused. They had put an orderly in the place of one of the RNs. The nurses were resentful. So this is late at night, and this woman is terrified. She said, "They're tying me up at night." And I said, "Who's tying you up?" She said, 2 nights ago when the orderly came on. I guess they're cheaper than nurses, right? So that's what they were doing, substituting. When you substitute an orderly for an RN, you're making a mistake.
What's the worst thing you could do during a pandemic? Plan to lay off 11,000 healthcare workers? Open for summer? Yell at doctors in front of their families? Dude, we're screwed. My name is Kieran Fong, and I want to know how screwed we really are. When I heard 11,000 healthcare workers could be laid off at the time when we needed them the most, I had to know more. Our Premier Jason Kenney sure pulled a fast one on Albertans. He promised to maintain or increase healthcare spending if he got elected.
So today, I would like to officially thank him for being an even bigger gong show than me, Premier Kenney.
If there's one compliment I can give my pal Kenney, he is one hell of a con man.
Thank you, Premier Ford. You've been a shining example of what not to do as a premier.
I stopped by my nana's, who was a hospital chaplain during the Klein era, aka the last time the government decided to push privatization in Alberta. What she told me made me fear for our future.
This feels really artificial, doesn't it?
Yeah, it does.
We've never sat down like this
Yeah.
to ever talk.
I know. So, Nan, when Kenney was elected, what was the reaction from your senior friends?
Do you want me to clean it up? I went to the Capsule Hospital where they had a palliative care volunteer program, and I found I had a gift. In life, most people are walking wounded. They've been wounded as a child, they've been wounded by other people, and they never heal. They don't go for therapy, they don't work it through. So I had worked through a lot, so I could go into almost anybody's room. When the Klein cuts came, I assumed that it couldn't get worse for chaplains because I wanted to go into that training because we are never paid after hours, etc. So I watched the nurses being attacked first. By the time I got to the U of A hospital to do my residency year, this was unheard of. I got there, paid my tuition, found out 2 days later that I had to open up body bags and prepare corpses. They had removed the nurses, obviously because they didn't have enough nurses for alive patients. Now at first I thought it was a joke. 2 of us said, right, and then found out that a theological student, about 25, was going to show us how to prepare the corpse. So the training was, there are the gloves, there are the masks, there are the gowns. They didn't get a nurse, they didn't get infectious disease control, they didn't get occupational health and safety, and he found it really amusing that we were disgusted. But when that more cooler door opened, the first thing that hit me was the smell. And about, 13 years later, the last morgue smell went away.
My grandma's experience was so traumatic that she was diagnosed with severe PTSD.
And then accidents were happening because ER was too busy to clean off a trach tube, a breathing tube that had been from an HIV patient. Then the laundry was privatized, the food was privatized, everybody was upset.
Can you tell me a little bit about how the privatization of hospitals affected food quality?
There was blood coming out of the chicken. And I said, oh my God, don't eat it. I'll get the charge nurse. So she came in and she said, oh my God, don't eat it. I'll give you a pass to go downstairs to get food. So there was terror, there was never an answer, and it just got worse and worse.
Klein didn't exactly love healthcare workers either. My uncle is an ER doctor. As a young boy, I always thought doctors were heroes. In 1996, he did a stint with Doctors Without Borders in Afghanistan. My grandma was sure proud of him when he returned. Then how come when Uncle Derrick finished his residency, he didn't return to Alberta?
Well, neither did his friends. You see, they were interns, residents. They saw what was happening with the Klein regime. Why would he stay around and be treated like dirt? They left. BC picks up a lot of Alberta nurses and doctors.
Listen, I suppose it's your right as a government to pick a fight. Go ahead if you want to. But why on earth would you be so reckless? Why on earth would you put so much stress on the front lines of the public service?
For me, it really is a passion. It's in my blood. It's in my genes to help workers find their voice, find their strength. Well, Ralph Klein came in 93. It was whole departments being privatized and contracted out in government services. He actually got a long way in his agenda. It was like a bulldozer coming, and we weren't ready for it. Other unions weren't ready for it. And it really wasn't until 1995 when he tried to privatize public laundries in the hospitals and in the health centers that there was the first time we saw some pushback, and there was actually fairly large wildcat strikes against that privatization. Ralph Klein continued on with his agenda of wanting to privatize the entire healthcare system, and actually introduced legislation to do that. Although there were still cuts, there's that very stark image of the Calgary General Hospital being basically blown up.
Patients weren't getting the care they got before. An ER doctor can only handle one patient at a time. So if you come in with a broken leg and there's nobody else in, they'll take you right away. But if somebody comes in not breathing and somebody comes in with a heart attack, the guy goes way down to the list. You have less nurses, you have people who were angry. They remembered how good the hospital was when the last time they were in, and now they're treated like dirt. You see the patients give death threats to the staff. It just kept snowballing.
And obviously, a lot of healthcare professionals left to go to other provinces, much like we're seeing now. In fact, some would say that we've never recovered from the cuts of the 90s, and here we are again entering a whole new round of cuts through the current government. There was huge campaigns against privatizing healthcare, and eventually Ralph Klein backed off. So it does show that when you pull together, when workers show their strength, and when society stands up against a regressive government or a dictatorial government, that they can win. But I see a different tone in this government. It's actually more aggressive, and it's more dictatorial, and it's less open, I think, to having that dialogue with workers and with citizens as a whole. It's just barreling through with its agenda.
For me, I got involved and wanted to become a politician because I realized that, we do not see change unless people feel engaged. And people will not engage unless they see people that they feel have integrity, people that they feel they can trust.
David, how severe is Alberta's doctor shortage?
Certainly from evidence that we have seen on social media from the doctors themselves, from the patients who are receiving the letters, and from other physicians who are talking about colleagues who have left, that we are seeing a significant drop in access to healthcare through physicians in the province of Alberta.
A lot of my colleagues have left emergency medicine for other areas of clinical medicine, like a tremendous and shocking amount, I would say. people are just really struggling to continue to cope in this environment, and so they've decided that emergency medicine, something that they've loved for so long, was not something that was for them anymore, so they've gone to different areas of clinical medicine.
Doctors that are leaving are quite clear about their reasons why, and that is because of the sheer antagonism that has been shown to them by Jason Kenney, the UCP, Health Minister Tyler Shandro.
It's been a bit different over the last year in the sense that things are getting bad, cases are going up, we're seeing hospitalizations increasing, we're seeing multiple people across all walks of life that are being affected by and getting really sick from COVID-19, and so it's been a real challenge to have to navigate that. You know, it wasn't just one time, it was multiple times throughout the last year that we saw this coming, that we raised the alarm bells, and unfortunately those alarm bells were listened to too late, and it resulted in people getting sick and people dying.
On the eve of the pandemic last year, at the end of February, we saw this government unilaterally tear up the agreement that was in place with physicians, and then immediately go on a very aggressive social media campaign accusing doctors of being greedy, entitled, and suggesting that maybe they were even abusing the billing system that was in place. The minister himself was on social media actively attacking doctors well into the month of March, even as we were coming close to having to shut things down for the first wave of COVID-19.
How fit do you think Tyler Shandro is to be Alberta's health minister?
His handling of, I think, negotiations on so many fronts with our healthcare workers has been needlessly aggressive, to the point where the minister himself went to the driveway of a physician in his community to yell at him in front of his wife and children. So I think we have seen that the temperament of the health minister, you know, his ability in the role, the majority, a vast majority of doctors in the province of Alberta who voted, they do not have confidence in this healthcare minister.
While most of us were abiding by the COVID rules, apparently they didn't apply to Jason and his buddies, who got together for an exclusive dinner at the Sky Palace. But don't worry, he assured everyone he didn't spend a lot of money on the whiskey.
We're going to be calling Tyler Shandro for a formal interview. Let's see what happens.
Good afternoon. You have reached the Calgary Acadia constituency office for MLA Tyler Shandro. Please leave a message after the tone.
Hey Tyler, this is Kieran calling. I'm outside the Sky Palace right now. Just wondering if you're available for an interview right now. Unfortunately, I tried to open the door and it's not open to the public, so I'm gonna need to borrow your access card ASAP. I also brought some Jameson whiskey for you. It's a budget whiskey, and hopefully you can reimburse me for it. And you can also come to my driveway and yell at me. I'd definitely be down for that too. Thanks. I think it went pretty well.
It was quite clear that the government wasn't going to be negotiating with physicians. They were starting to do weird things like floating ideas about our contract in the media without actually talking to us.
They're quite critical of a number of academics. They're quite critical of really anyone, and sometimes use very hostile, uncivil, bullying kind of language.
Matt Wolf, working in the Premier's office, put out a series of tweets that were meant to question my character in multiple ways. And one of those tweets was about linking me with Rachel Notley and Jagmeet Singh. But one of those pictures, the one with Jagmeet Singh, actually it was a family photo with him, so it had my kids in it too. To see this series of tweets that was clearly meant to bring upon harassment and question my character and my mental health, and then to have my kids in as part of that, it was really quite terrifying. Any mother would understand why that would feel very intrusive. Have a government specifically pull it out and put it in a thread that is meant to get people to harass me, it feels very intimidating.
To bully people is to try to silence their free speech. And governments shouldn't be trying to silence speech that's critical of them. That's part of democracy.
Today, Tyler Shandro is imposing massive pay cuts and systemic upheaval on Alberta's doctors, even as those same doctors are risking their lives to protect us during a global pandemic.
Then on April 1st, the minister went ahead and he forced through a broad suite of changes. So doctors, in the midst of dealing with a pandemic, had to deal with mountains of paperwork, having to learn all new billing codes, a whole new system, while still trying to take care of patients in a very unknown situation at the beginning of a global pandemic.
What we look for in governments is that they're transparent, they're accountable, they're responsive to the public, and this is a government that hasn't always done that.
And do you notice that Kenny said he was bringing in foreign doctors? I thought, yeah, he's smart enough to know no Canadian doctor from another province would come here.
We are graduating entire classes of doctors that could be serving the people of Alberta, that could be trained to go out and work in rural areas where they are badly needed, and they are choosing to leave.
Because everybody across the country knows what's happening here. If you're a doctor, you know what's going on. If you're a nurse, you know what's going on. So why would you come here?
They're exhausted. Many are quitting, many are on leave, many are retiring early, many are just leaving the province and they're not coming back.
I moved with 4 kids in the middle of a pandemic. We've all left in really difficult circumstances that were not what we wanted. If the UCP had followed some basic common rules of engagement when it comes to how they communicated with physicians, a lot of the upheaval when it comes to doctors leaving could easily have been avoided.
It just felt like my reserves were always low. Like there was no refilling the cup, so to speak. It was just always running on empty and trying to just get through the next shift and get through the next little stretch.
We feel short. I know a lot of people, even myself, when we go in, it's just like we don't have enough. That caring is gone now. It's just you're there, you're doing your job. It's not enjoyable anymore. You're exhausted and you just don't want to do the extra mile, or you can't anymore. Just keep doing it.
We've had to make a lot of personal sacrifices, I think. Kind of what that meant for my family was potentially not seeing my young kids for 2 weeks or multiple weeks at a time.
So it's really hard when you're on your days off and you're tired and you've got all the other mom stuff to do, like cleaning and stuff, and you just don't have time or the energy to be the mom you want to be with them. It's been really hard to do that, yeah.
Keeping everything in the garage so it doesn't come into the house, walking in the door, and normally the first thing my kids would do was come and hug me and hug my legs, and just kind of having to back away and being like, no, you can't hug mommy right now. We just have to wait, and like then just seeing the hurt on their face when I'd have to do that. It's not just me, it's all healthcare workers that have had to go through these similar personal changes and personal sacrifices within their own family so that we can continue to serve Albertans.
Indeed, their failure to follow through and provide proper pay for virtual visits. In Alberta, doctors were given a single code to begin with by the end of March that allowed them to charge $20 for a visit. Meanwhile, this government was paying TELUS through their Babylon Health app for virtual doctors who did not know these patients to provide virtual walk-in service just under $40.
Your health and well-being are everything. So when you have a concern, it's comforting to know you can see a local healthcare professional right from your smartphone.
And while the government did increase it to about $38, they did not allow for extended times. So doctors were spending 20, 30, 40 minutes with their patients, providing care in the midst of a pandemic and being paid for 15. So that did incredible damage to primary care physicians, people's family doctors. And it caused, indeed, some family clinics to have to shut down. Other doctors have chosen to leave the province. And that's just one segment of physicians.
And even now, with talk of removing the need for having a registered nurse in charge of a unit, I think is a huge safety issue. So it's not just about wages, it's just about, I think, safety and good, healthy working environments.
Even though these folks have got us, are getting us through the worst pandemic we've seen in 100 years, they've been there every step of the way protecting Albertans, but there's not enough of them, and they're starting to crumble, and they're starting to just drop. So that means that there's even more strain on the healthcare system. So that means there's a big gap to fill, and the UCP intend on filling that with private services.
AHS came out just the other day and said up to 117 acute care beds in the province of Alberta are closed for the summer because they do not have the staff to cover. We're seeing that across the province of Alberta.
And this is a tactic or a strategy that you'll see right-wing governments move. They'll bleed the system so it becomes almost unusable, or it becomes totally dysfunctional, so that they can step in and replace it with a private system.
TELUS has invested in a series of private healthcare clinics here in the province of Alberta that bill for additional services, something that our government was looking at ending that practice in the province of Alberta.
The public will see their services diminish, yet the cost of those services won't be reduced. In fact, they could increase because these corporations demand more and more money. So that's who benefits, the corporations and the government working hand in hand. People who suffer, obviously, are people who try and access the healthcare system, i.e. the population and the public of Alberta, and also the workers who provide those services suffer as well.
Private folks that deliver it, they get to skim a little more money out of the healthcare system. They get to take a piece in profit that should be going to paying for people's care. And who loses? Well, the people of Alberta. By setting up more private surgical facilities, we're going to take surgeons, anesthetists, anesthesiologists, and nurses away from the public system.
The equality that we fought so long and hard for in society is being undermined now more than it has for a very long time.
This government is so secretive. I still hadn't heard back from Chandro. Maybe the UCP MLAs could tell me the real reasons why they wanted to privatize healthcare.
Sorry, are you guys UCP MLAs by any chance? No. Do you know where they come in? Some here, some... Okay. Oh, okay. Gotcha. They must come in really early then, because I thought it started at 1:30. Okay, I just need to call Jason.
Thank you for calling the office of the Honorable Jason Kenney, Premier of Alberta. If you would like to speak to the receptionist for the office of the Premier, please press 2. Calls may be recorded and used for quality and training purposes. Office of the Premier, this is Kieran.
Hey, Kieran. This is Kieran Fong talking. I'd just like to congratulate Premier Kenney on the 22% approval rating. Hey, at least he's in the double digits. There was a bit of a mess up with the gift that I offered Tyler Chandro. I meant to actually offer Tyler Chandro this book instead. And I also have a bottle of Jameson whiskey for him if he agrees to an interview with me. So really excited about that. If you could relay the message to him, I'd really appreciate that. Oh.
One moment, please.
Okay, thank you.
All I can do is pass that on, sir. I'm sorry.
You can pass it on?
I will pass it on.
Okay, I appreciate that. Thank you so much, Karen. Have a nice day.
You're welcome. You too, Danyaal.
Bye. Really tried to give this book to the UCP MLAs and find out their thoughts on whether they want to privatize healthcare. I tried knocking on the door. Hello? I have a gift for Jason. And a good book that I think all the MLAs could read. Fortunately, they wouldn't let me in, which kind of sucks. So I'm then going to leave this book and the bottle of Jameson as a gift for them for their service to this province.
So what the Alberta government is trying to open up is more private delivery. Now, private delivery is, the money is still public, the money is coming from the government, but the care is being delivered in private facilities.
So who's going to lose? The people of Alberta. Because they're going to have less access to care, whether it's here in the heart of my constituency or whether it's in rural communities across the province of Alberta.
There is not an infinite number of healthcare professionals to staff these private facilities. And so in some ways, all we're doing is moving health professionals and moving patients around. The outcomes in the for-profit private long-term care facilities are poorer than in the public-run facilities. And so, for example, mortality rates were higher with COVID in those facilities, and unfortunately is something that we're likely to see more of in Alberta. In order to make more of a profit, there's an incentive to cut corners. And where we most often see those corners cut is in terms of staffing. And of course, the less patient care that people receive, particularly those that are in frail health or have complex medical needs, that can show up in terms of complications that they experience, things like pressure ulcers, those kinds of complications, falls.
What's happening in Alberta and what I'm concerned about is on the delivery side, but as you move towards more for-profit delivery, that's the thin edge of the wedge that introduces more private financing. I'm in a province that's run by Doug Ford.
Gotta give Timmy's a good plug. The best thing you guys ever did is make those real egg sandwiches. I used to go eat those other ones. They're the best, those real egg sandwiches. So whoever did that at Timmy's, good for you.
It's no secret that what's happening in Alberta can sometimes tell the tale of what will happen in other countries led by similar leaders, including Doug Ford in Ontario.
I can always bust his chops. He's great.
There have been a number of successful initiatives that show the kinds of things that help to reduce wait times in the public system. They can centralize referrals so that patients move through the system more efficiently. Funding operating rooms to operate full capacity, and working on recruitment and retention of healthcare workers. In terms of making a healthier population, we can think about covering pharmaceuticals and covering other forms of healthcare.
Before the pandemic, there was a study that came out that found there were 1 million Canadians who were doing things like skipping food purchases or turning down their heat in order to make the money they needed to actually pay for their prescription drugs. So I think we actually have a lot of room to invest more in public health care, not just in the services that are already covered, like doctors and hospitals, but prescription drugs, but also dental care, more robust funding for long-term care.
But it's difficult to compare Canada to countries like Australia or the UK or Germany or the Netherlands, because all of those countries have some amount of two-tier care where they have a public system, but then they also have patients who are able to buy access to a private system. And so in the UK, for example, they've had to pass regulations to try to ensure that doctors are spending adequate time treating public patients so that their National Health Service doesn't feel the strain of a two-tier system. And interestingly, many experts in those jurisdictions will point to Canada as an example of an excellent way to set up a healthcare system.
I had a chance to meet Senator Sanders on 2 occasions. First is when he came to Toronto to essentially do a tour of the hospitals here and learn a little bit about how healthcare worked on this side of the border from an on-the-ground perspective, and then take that back to the Medicare for All campaign he was part of and a leader of in the U.S. And the second time was about a year later when I was invited down to Washington, D.C. to participate in a town hall that his team had organized.
You know, I think what the American people need to know about healthcare in Canada is that access to care, it's not based on your ability to pay, and it's not based on your bank account balance.
You know, when I told the story of how healthcare works in Canada, both the things that we do really well, but also the things that we need to do better at, namely, expanding Medicare, expanding our public system to include things like prescription drugs and pharmacare. And it was also a really inspiring moment for me. Because, I'm looking at the Medicare for All movement in the U.S., and what they're aspiring to is not what we have in Canada. They're actually aspiring for a much more comprehensive system, one that doesn't just include doctors and hospitals, which is what we have in Medicare in Canada, but also that it includes prescription drugs, that includes long-term care, that includes dental care in a more meaningful way.
We have the momentum, but we're not going to win this fight unless all of us are actively involved, unless we stand up, unless we fight back, unless we make sure that every American recognizes that healthcare is a right, not a privilege. Thank you all very much.
So David, many doctors have left Alberta and are likely never coming back. How does that make you feel as a citizen?
You know, I find it deeply concerning. I think back to, the 90s when we had a series of cuts under then Premier Ralph Klein. And I remember my family lost our family doctor. He chose to leave Alberta and he moved to the States. And it was a number of years after that before I found another family physician. So I know that experience, what that feels like for Albertans. And I am deeply concerned.
I'm a nurse for 40 years. I've never seen anything like this. We have patients who are 57 years old, came to the hospital, died 48 hours later, unvaccinated. Her 34-year-old daughter came within a week, unvaccinated. She will probably die this week if she hasn't died already. It's up to you, each and every one of you out there, to do your part to keep every single person safe. Your family, your children, your grandchildren, your neighbor, and us nurses, we need your help. We're not the front line anymore. The public is the front line now.
What we need to see is less antagonism with this government, more of a collaborative approach to actually sit down with the elected representatives of these healthcare workers.
We already see now with bed closures across the province of Alberta, doctors being lost, a shortage of nurses. That undermines the quality of care. The longer we force people to sit and wait and suffer, the more complex their conditions get, the more we have to put into that treatment. It's more work for everybody. It costs us more.
We're in the fourth wave. Our numbers are very high. Hospitals are reporting great strain, yet the government is nowhere to be found. It's been weeks since we've heard from the Premier, the Minister of Health, the Chief Medical Officer of Health.
What we are looking at right now is an utter undermining of our public health care system in the province of Alberta, and it's going to take a long time for any future government to undo that damage.
The damage will be felt for many years.
We've got a long way to go in this society. There's still a lot of marginalized folks out there that need someone to stand up for them as well and help them amplify their voice. And that work is done through unions and other progressive organizations in society.
And as much and as hard as you work together in your work sites, keeping Albertans healthy and safe, they're willing and ready to work as hard and as diligently with you on the streets, because if that's where we have to take it, that's where we will take it.
And it starts right at the bargaining table to support workers to have good working conditions, things that support them, for them to be able to do their job and to be able to provide for their families, which benefits all communities.
So I see very little hope unless all of the citizens of this province start making noise.
Now, if you think it's strange that mice should elect a government made up of cats, you just look at the history of Canada for the last 90 years, and maybe you'll see that they weren't any stupider than we are. Now, I'm not...
Before I was even 10, I heard Tommy Douglas talk about the people who died. And that's why I'm doing this, otherwise I wouldn't be doing this, dear. I believe that everyone, regardless of who you are, how poor you are, gets health care.
Although the world may seem bleak now, we have the opportunity to create transformative changes. Through grassroots activism, we will mobilize for universal pharmacare, dental care, and a Green New Deal. We will unite hundreds of community organizations and dozens of national groups. Regardless of who's in power, we will get it done. Chris Hedges wrote, "The most difficult existential dilemma we face is to at once acknowledge the bleakness before us and act, to refuse to succumb to cynicism and despair." If Tommy Douglas were alive today, what would he want us to do?
People can afford to pay the per capita tax, and the people who can afford to pay extra billing will pay it. And they will get the best care. They will get the most experienced surgeons and physicians. They will get into the best hospitals. And the people who can't pay, they'll take what's left. If you want a two-tiered health program than just continue the way we're going. And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child, irrespective of their color, their race, or their financial status, and by God, we're going to do it!